Good afternoon, everyone, and welcome to our March of Dimes MCH call for this afternoon. I'm Steve Farpstein, and I'm chair of our National Volunteer Leadership Council. I'd like to welcome all of you, and I'd also like to thank you so much for joining us. Lots of important information to talk about. As many of you know, we've gone through some changes that we've been working on these last couple of months and have started the implementation with that. And it was vitally important to us that we make sure we're reaching out to all volunteers to explain what's going on, to show you how we're going to be operating in the next year, and to also make sure we answer any questions that anybody might have. And so a lot to talk about today, but it's an honor for me to first introduce Dr. Ral Gupta. Dr. Gupta, as you know, is our senior chief medical officer. He's done amazing things since his arrival here at the March of Dimes. And again, like everything else we do, it's imperative that all of our executives are keeping us abreast of what's going on and making themselves available. So Dr. Gupta, thank you once again for being a big part of how we operate. And I'd like to turn the call over to you.
Well, thank you very much, Steve, and good afternoon or good morning, as the case may be, for everyone. And thank you to Megan as well. I want to first of all, hope that everyone's having a great New Year at the holiday season. We want to thank every one of you for your efforts and what you have accomplished for us and for the moms and babies out there in the past year. I think it's been phenomenal, and the amount of work that has gone in. At the same time as we have done the core work together, we've also recognized the importance of listening and being able to evolve and get the feedback and improve ourselves. So today I want to talk to you a little bit about how we are moving forward, how we have heard you, and some of those changes that are happening that may excite you. To begin with, as you can see on the slide, we've really done a phenomenal move forward to incorporate the health of moms as well as babies in the way we speak about mom and baby as one unit, as one crisis and one problem, not two. Of course, as you're all aware, our goals are to eliminate preventable maternal mortality and morbidity, as well as preventable prematurity and infant mortality in this country. And we're going to do that by being very intentional about, first and foremost, working to end the health equity gap that exists and that is unacceptable. We, of course, have done a lot of thought process in this over the last year to figure out what is our role. There's so many other organizations, good organizations, governmental, non-governmental, private, and nonprofit, as well as academia working in this area along with policy partners. We believe at March of Dimes that we could primarily be thought leaders and conveners, as well as mobilizers with your help, and that will lead us to become drivers of tangible impact. So this is where the role for all of us working together becomes so much more important and so much more tangible. We believe, as you can see on your right hand of your slide, we really look at these two crises as well as equity, and the middle is what we call our sweet spot. We think there's a lot of issues in maternal mortality and morbidity, similarly in prematurity and infant mortality. We think where it unites and joins in a way that it affects both equity but also the mom and baby issues is where we can be most effective in becoming thought leaders and conveners and mobilizers. Where do we need to go together? I think right now we're working on, and Megan will talk to you a lot about, and with Steve's leadership, we've been able to accomplish and incorporate much more advocacy into our maternal child health or MCH committees. So I think what you're going to see both in localities as well as across the states in several parts of the country, with your help, you're going to see us work to incorporate the MCH committees as well as the advocacy and mobilization all the way into the boards, market boards, and others. So I think, one of the things we've done really intentionally is listen to you and listen how important it is to be able to speak with one voice and align our efforts together at the local level, at the community level where it matters the most. And this is why we're having to make some smaller tweaks in order to have the best alignment possible. And we're going to talk about that today. And Megan and Steve and I will be here to answer any questions should you have any. So with that, I will turn it back over to Megan.
Great. Thank you, Dr. Gupta. And again, appreciate all you do for us. So now I'd like to introduce Megan Walker. Megan is our Chief Volunteer Officer for the entire organization. She is my partner that I deal with. And Megan also works very closely with Kelly Ernst and Allison Spira to make sure that our markets across the country are functioning and all of our volunteers are incorporated in our mission. Megan has worked tirelessly on some of the changes, and so what we thought we would do now is ask her to lead us in explaining what's going on, a little bit of the background, and kind of take us to where we're heading in 2020. So Megan, I'll turn everything over to you.
Thanks, Steve and Dr. Gupta, and great seeing you all today. What we want to talk through today is sort of that evolution of the change we've been talking about. So as Dr. Gupta just mentioned, our goals are really in the areas of impact around ending preventable maternal mortality, morbidity, prematurity, and related health inequities, but also around movement, growth, and performance. These are sort of the pillars of our strategy, and how as that strategy sort of works together, there's a piece that the performance piece is what really undergirds it all. So as we've been considering some of those elements of the operating model, our structures, our processes, our governance, our culture, our talent and technology here at the March of Dimes, and we're continuing to evolve as an organization, one of the elements is how we're organized to meet our goals. So the goals that Dr. Gupta just talked about, they are our North Star. That's what everything we do is in service of. But then how we are operating, how we're structured is really in support of that. So if you've been a volunteer with us for a while, which many of you have, and we appreciate that over a number of years, you've seen maybe some different organizational structures. And so on the staff side, some of the minor changes we're making is to structure ourselves in a way that is based on sort of the needs of that state and the demands of that region. And so you'll see on this map that there are some areas that we consider sort of high growth, high need opportunities like California, Texas, Florida, Illinois, New York, and Northern New Jersey, the DMV area of Maryland and Virginia, and the Northeast that we're kind of pulling out as states that have sort of dedicated resources for high fundraising opportunities that also have a lot of growth potential. But then there's also states like you'll see in the lighter purple, like Arkansas, Louisiana, Mississippi, Alabama, Georgia, West Virginia, and Puerto Rico that are high need areas. So those are mission critical states that received an F on the report card, the March of Dimes report card last year, that are, we're never going to abandon those states. So even if we're not raising quite as much money in those areas, we need a very specifically honed strategy so we can continue to see progress on our report card and continue to see rates not worsening, going in the right direction, improving. So, this is sort of a semantical issue in terms of how we're organized. There's still an East region and a West region, but there are some implications for how we're organizing as a staff, because a couple of years ago, we were in a state where we did a strategic realignment where we kind of pulled apart some of the functional areas. We said, okay, an executive director at a local level is really going to focus a little bit more on the fundraising side, and the mission folks are going to report up through sort of a centralized maternal and child health kind of area, and then NICU, it was even supported in another area. So you can even see on the slide, there are some silos, like you can even visually see the silos that that's creating. So where we're going as an organization, and these changes are actually in full swing here in January, is to have sort of a local market that really is integrated at its core. So the executive direct, all of those elements you saw in the previous slide, including fundraising, including our mission, maternal and child health work programs, including advocacy, NICU, and our cross-sector partnerships, are all reporting up to one local person, which really will provide a lot more integration and will help drive increased fundraising and increased mission, because our goal here is that we need to lead with mission. that I think is a core tenet to the work as we go forward, is how can we lead with mission, and having mission kind of separated was not allowing us to do that. So you're probably asking, okay, so what does this have to do with me? And I think that's where I wanted to quickly go through on the staffing side, that's where we're headed. But really, exactly as Dr. Gupta mentioned, we've listened to you, and we want to, then the volunteer element of this, the volunteer structure, we'd like it to really match that staffing structure. We want, the volunteers are the lifeblood of this organization, and we can't do this work without you. Period. And we don't ever want to. And so we want to make sure that, number one, we're listening to you. So as we started to think about sort of what is the volunteer structure that should accompany this new staff structure, we turned to a couple of groups, including our National Volunteer Leadership Council, which Steve is the chair of, including many MCH champions who are on MCH committees, just like all of you, including, representatives from local markets. I think I saw Karen Harris and Matt Wallace were on the call, but I'm not sure because there's a lot of participants. So if you're on, hello, and thank you for your feedback on this, as well as our Board of Trustees. And so this is just another step in that whole process. We talked to MCH chairs last week, and we wanted to open a call where we can provide to you our ideas, our plan of how we see this structure rolling out, and continue to get your feedback on it as we go so that we can make it the best that it can be. So that's what we'd like to talk about for the next few minutes, is what is that volunteer structure? So a couple of things we were trying to solve for. One is that lack of integration. It's the exact same thing we were talking about from a staff perspective, but with separate boards and mission committees and advocacy committees as a third separate area, we're finding that we didn't have as much integration. So some of the geographies were kind of mismatched based on the region, and we weren't really providing you with the clarity of role and the clarity of, and really the appropriate staffing to be successful. And so that's something we need to do a better job of. I've heard that from mission volunteers as well, to say, okay, our role used to be focused a little more on grants or on strategic mission investment plans, or something along those lines. Where are we going? It was unclear as we were in kind of the messy middle of some of these operational changes. Now we're at a point where we've kind of come through that process, and we do have some additional clarity on what volunteer roles will really be successful for us, and where we need the most help from you all, and where we can utilize your distinctive expertise in these areas. And so that's what we really want to focus on. In addition to that, there's some core tenets around, where staff are integrated, volunteers are integrated, and we also want to recognize that we know there's been a lot of change. I've been in this role for a little over a year, so not long enough to experience a lot of this change, but I've heard it from countless number of people that there has been several realignments, and so we want to make sure that we honor that and understand that. But we also know that many of you all work for large health systems or other organizations that have a continuous evolution process, and that we think that we're really confident that this evolution will help us achieve our goals, that this is going to help us serve more moms and babies. So we also know we don't want to create changes that are going to upset, some of our big fundraising areas, but that we need to lead with mission. I'll say it again because it's important enough to say a second time, that where we go in and just ask for March for Babies sponsorships, etc., we're not seeing those partnerships grow. Where we go in and we talk about impact programs and true outcome-based programs like supportive pregnancy care, like our NICU family support program, like our implicit bias training, where we're talking about here's how this work is changing lives on the ground in your community. That's where we're seeing success. And so the more we can lead with mission, even in our fundraising efforts, that's more funds that we can devote to the research, to the advocacy, and to the programs that matter. So saying all that, the last thing I want to say on this is that anything I'm going to say from this point out is also not set in stone, and it's not a cookie cutter approach where I'm going to say this is the way every volunteer structure should look like in the country. We know that you know your community best, and so if there are some differences that, based on your community, based on your state, based on how many staff are in your state, or how many committees, how many local boards are in your state, that is up for you and your staff partners to help to decide. These are recommendations that we think will largely work for most of the US, but we know that anything can be adapted locally. So please know that. So here's our first sort of big recommendation and recommended change that we'd like to put into place, which is, we're going to continue to keep boards local. We're not sort of merging any boards, or we're not changing the boards at its core. However, we are changing sort of their charter. What is a board meant to accomplish? And we're saying that not only should it have sort of strategic guidance in the fundraising area, but that local board, just like that local executive director you saw, everyone kind of reports up through there, that the local board would be sort of that area that oversees all impact, movement, and growth efforts. And those, again, you saw are the core pillars of our strategic plan. So what we would suggest is some standing committees. One, and the one that's probably going to be most important to you as mission and advocacy committee members on this call, is that the impact, and that we suggest a standing committee at the local board level, not separate from at a statewide level, but at the local board level as an element of the board for them to have an impact committee locally. Also a growth committee, and we're going to talk about what would that impact committee do. We'll come right back to that. Also a growth committee that would tie into the, the special event season, the special event fundraising, stewardship, corporate giving, all, high net worth individual giving at a local level, and also a movement and marketing and engagement committee meeting. And again, these can be adapted locally, but for that increasing brand awareness and relevance in communities and engaging individuals on a local level. There's also, we know there's special initiatives in some areas like birth equity committees or collective impact work. And so whether those stand separately like a prematurity collaborative, or whether they're incorporated under that impact and mission or policy committee, that can be decided locally, but we know there could be some other things. And then we know there's also some there's some performance-based elements that are really best practices. Every board should have a chair, an incoming chair. They should have chairs for these committees. They should have a nominating and recruiting chair, as well as a volunteer engagement chair that helps to develop individual engagement plans. So those are some of the things that we would consider for the board. And then but non-board members can serve on these suggested committees. So, there can be non-board members on your impact committee, on your mission committee locally. And we'll talk a little bit more about that in a second as well. All full board members at a local level, however, will be responsible for a give-get, whatever the give-get is for that local board, which varies based on the board. However, there can be flexibility in this. So it doesn't have to be sort of this, big check that gets written. It could also be partnerships that you bring in, could be, in-kind contribution based on your expertise, serving on a panel, or, reviewing important data sets, something like that. So there can be a lot of flexibility in that give-get. So I don't want that to scare anyone away when they sort of hear that. We obviously need to revise job descriptions and charters, market board guidelines, standards of excellence. Everything needs to be revised to reflect what we're saying. And the staff partner will continue to be the local executive director. However, the mission committee could have the functional lead, which could still serve as that MCH staff member that you probably are most familiar with right now. The second big element is around statewide committee roll-ups. And roll-ups is not really an official title, but the idea is that all three of those standing committees would then meet with their counterparts across the state, maybe on an annual or semi-annual basis, once or twice a year. So right now, it's likely that you serve on a statewide MCH committee, although there could be various forms. And in some cases, these groups are already integrated in the local boards. And you're looking at me if you're in Ohio, for example, and you're saying, I already do this. What are you telling me that's new? So in some cases, this is already happening. And others that maybe do meet separately or are not as connected, maybe this is going to sound a little bit different. But the idea is that these local committees could then roll up to a statewide level, just like you're doing now, because we know there's crucial work that happens at a statewide level. If you're affecting a statewide health law or, policies that are happening at the health department, et cetera, then you need to do it at a statewide level. We realize that. So we're not saying that it's all local. There will still be these roll-ups where you can share best practices, you can have those state level strategies. But the primary identity of you as an MCH volunteer will now, kind of be a board member first. So you're still on the MCH committee of that local board, or as an MCH committee member at the local level if you don't want to be on the full board. So that's sort of the shift that we're making here, and we'll talk a little bit more about that. Another suggestion we're saying is that we need to merge those mission committees, the MCH committees, and the policy work. We need to merge those together in all states. Because we just don't have the bandwidth to kind of have those as separate entities, and likely the work ends up being rather similar in some cases as well. So that's another recommendation we're making here. You can also stay as a statewide advisor, if, for some reason you're not in an area where there's a local board, for example, and you want to stay as a statewide advisor, and that is absolutely a possibility. And we similarly need to revise the job descriptions and the roles. So if there's questions, keep them coming in. In those 7 priority states that I mentioned to you, Texas, Florida, California, Illinois, DMV, Northeast, New York, New Jersey. Those are sort of states that are going to have some dedicated resources called senior executive directors. If you've been with us a while, it's not 100% dissimilar from like the state directors that we used to have in those 7 states. So those would be the staff leads for these roll-up committees that we're talking about. But again, MCH staff members would be integral in this. So you might be asking yourself, what's the new mission committee going to do? And so these are just ideas because I think we want to work with you. And this is one of the questions I want you to be thinking about is like, what would the role be of these local MCH committees? But, first and foremost, it's analyzing local data and acting on it locally. Helping us, we've got a lot of work to do on our data, but there's a lot of effort being put towards that. We also want to look at collective impact where those sites exist and really support that effort. Open doors to partners that you're working with and help us, implement mission investment programs, as we mentioned before, like NICU or family support and supportive pregnancy care. And really, you've always done this. You're always going to be our spokespeople, our advocates, our trainers, our consultants, our champions for mission, not just with, within your circles, but also within the board. Like having this mission voice stronger on the board, I think is just going to broaden the discussions in a way that they haven't been most recently, with our staff, with our donors, with the media, with other volunteers that you encounter. Advise on new opportunities and direction locally, whether that's sort of mission investment opportunities or strategy or other products that we're rolling out. And then of course there's a big element related to policy here. So these are just a couple of our staff ideas, but I think, so as you're thinking, what's the focus? Here's what I've been doing in the past. Is that the same or different? These are some ideas, but there's lots more there. So what does this mean for you? This is sort of the what does it mean for you slide, which is, as you consider your role, as I mentioned, the roles are shifting and the statewide independent entity is changing, the structure is changing. So as you think about how would I like to continue my work with the March of Dimes? Because my number one goal is that no one walks away from this call saying, I don't want, I want to roll number 4, right? I don't want a lot of folks to roll off unless, of course, your job's changing, the demands are different. Of course, we understand, I'm retiring and I'm going to travel the world. We understand time commitments change and shift. But as you're thinking about what you'd like to recommit to, one option is to join the local board, which, I think that's an option that we'd love to explore. We are asking that you meet the requirements of any other local board member. So that would include the give-get or the meeting number requirement or any other sort of requirements, and we can talk through what those might be with your local staff people. The other option is you could join the local MCH subcommittee, and not serve as a full voting member of the board. So you could, which is essentially, you know, this is sort of the de facto option. This is essentially what we're doing now in your current committee structure, but at a local level. The third option, as I mentioned, is you can just attend one of those roll-up meetings of all of the local MCH groups. So a statewide annual meeting, and we would want to create an individual stewardship plan for you so that we don't lose you the rest of the year. If there's other ways that you can engage on a specific project, like you know, on a data analytics project or on like a certain advocacy ask that we have at a state level. So there could be, but we would want to continue to engage you or activate you as needed. So those are a couple of the options that we wanted to discuss. And really it's as simple as, you know, having a conversation with either your MCH chair, your advocacy chair, the board chair, or your staff partner to just discuss those options that I just addressed. They should be reaching out to you. So you don't have to worry about sort of, you know, setting that meeting. They'll reach out to you. But if you happen to know them well and want to chat about it, that's sort of the big next step. You know, we need you to stay engaged. And that's our primary goal, is that we want you to stay engaged with us in any way. So maybe there's another option that we haven't considered here, and we'd love to hear that too. So we want you to just consider, we will publish a position description that kind of explains what are the roles that we were just talking about. And you can take some time to consider the best way for you to contribute. And we can also provide some additional training and resources, as well as we have a group of National Volunteer Leadership Council members, which is made up of many of your peers, that can help to assist in this transition if you have some additional questions for your local area. So some of the next steps include, we wanted to talk to you as MCH members first before we even talk to boards, because we know that this change sort of affects you all a little bit more than the boards. But the boards, I'm meeting with them on Thursday. And then there's a communication that's going to go out that says everything we just talked about later this week. Steve is hosting some open office hours next week, and you'll get a note about that. If you haven't joined the Volunteer Hub, that's another way you can stay up to date on this kind of information as it's ongoing. And there's some additional resources on our Volunteer Learning Center, which is just volunteer.marchofdimes.org. And then we'd really like to start to see this integration roll out at the end of the first quarter here. Our deadline goal is for those 7 states and regions I mentioned is really in the first 6 months, and then within the first year for as many others as we can, realizing it may take some time to fully integrate those structures. So we know we need to get you a ton of resources, talking points, emails, PowerPoints, fact sheets, you know, job descriptions, charters. We're working on all of it, but we wanted to get something to you now at the beginning of the new year as we do start to plan for the year. And as many groups are still kind of asking themselves that question, what are we doing? How can we accomplish what we're trying to achieve? So, you know, I had some questions for you, and I'd love any questions for me in the chat. But before I ask these questions, I wanted to see if Dr. Gupta, you had any other thoughts, because I know that's like a ton of information about anything I shared, or any other kind of thoughts that you wanted to add.
You're on mute, Dr. Gupta.
No, I think you've covered it pretty well, Megan. And I think the whole idea here is flexibility and alignment. So as you well said, we're trying to be as flexible to the needs to make sure that we are all accomplishing the goals that we set together of addressing maternal and child health, as well as you know, mobilizing, and at the same time we're as much aligned as possible, but at all local levels. So with that, I'm very happy to answer it along with you.
Okay, great.
Any that might be.
Yeah, okay, yes, there is a question for you, but let me answer one of these other ones first. So one of them was, to what extent is diversity and inclusion considered beyond educational and professional backgrounds? I think, Calvin, that's an awesome question. And it's one that I'm having a team retreat tomorrow, and I'm spending a significant period of time discussing that exact question on, number one, how are we recruiting folks with more diverse backgrounds? That can be anything, like you said, from their education, their area in the country, their race and ethnicity, their, so many different areas. Another area we want to focus on too is including sort of our National Youth Council and younger voices in some of these conversations. So what we're doing, first of all, I'll just say that we have just committed to making sure that everyone in our staff is trained on diversity inclusion in Q1 of this year. I've also added a commitment to train all board members have a board level training on diversity and inclusion, probably in the first half or 2/3 of the year. And I think that will also help in terms of recruiting diverse workforces. And it almost dovetails into a question for you, Dr. G, around, can you give us an update on implicit bias training and sort of where we are with that? Because it kind of goes hand in hand a little bit.
Yes, I think that's a great question as well, because diversity and inclusion, really what it means is, it's a broad net, and we just have to be mindful that we're being as inclusive as possible. It's a mindset a lot more, and we always try to put it into terms of rules, regulations, policies, but it's really an organizational mindset. In terms of, thank you for that question, Darcy. In terms of implicit bias training, we have been working with this firm, Quality Interactions, and we do have a demo ready. The next step with that demo is really to have that demo with our some of our partners we're working with right now, as well as then once the product is ready, which it should be at this point, meaning anytime this month, what we want to do is we want to start to do staff training, and we've actually Darlene is going to be talking a lot more for our staff, boards, and others to get some training done for that. And then we move forward to ensuring that everyone that can and is willing to be trained with that product gets trained. So we're really looking at this as an objectively from a timeline standpoint. First, rolling it out to the March of Dimes staff, in the next month or so, and then further expanding it slowly to make sure that all our volunteers who all want to be trained are able to be trained, as well as then, our goal is really to make sure that there are, if you're a maternity or child health provider and you're really willing to do it, we want to provide this to you. Of course, for those folks, it's going to, we're working on what does a business model look like, what does the cost look like, and things like that. And that's pretty much been firmed up. Ariane here is who's out this week, but she's also taking the lead in developing sort of the prospects of where we should, our goal would be to have at least 1,000 practitioners trained by the end of the year. This is exclusive of our own volunteers and staff and other members.
And I think this is a follow-up question to that, which is there an implicit association test assessment tool or offering provided or recommended by MAUDE or of the groups just identified?
Yeah, I think what we're trying to do is, California has actually required it as part of legislature. There are going to be other states probably in this session that are going to either attempt to or as being successful in passing legislation to require this. So we're actually developing, we're not there yet, so that's why I hesitate a little bit. We're working to first launch the training and then start to, at the same time in the background, work on some type of an assessment tool, as well as evaluate our training and then figure out what does implicit bias training 2.0 look like, because we all understand, to be serious, an hour or two of training isn't going to address fully the issues that we're trying to address. So it's going to take a lot more. But we're wanting to put that training out there so we can actually then work on follow-up trainings as well.
Okay, Dr. G, I'm going to need your help with the next two also. So there's another question about advocacy. And I think it's sort of, what's our role in advocacy? And so I think there's a volunteer role, which I'll answer, and then a larger role question, which you can answer. So, there used to be a staff member, that organized Hill Days, et cetera. And so I would say from an advocacy perspective, our role, it needs to continue to be strong, especially as volunteers. So that's not going away in the new structure. It's just to say that it's getting merged in with mission committees. So that standing committee of the board, the impact mission committee, will also include a strong policy agenda. We have a policy agenda at the national level, and then there's statewide policy wins, hundreds of them that happen every year at a local level. So the staffing may look slightly different on that, but wanted to turn it over to you on that one.
Yeah, wonderful. Yeah, I think you're exactly right. Policy is the tool to make, just like vaccination was for polio, policy is the same tool of the 21st century to address a lot of our problems that we're dealing with, at least in our business. And advocacy mobilization is the way to get there, to ensure that we have policy and action occur. So it's not going away, as Megan said. In fact, what we wanted to do with some of this is align further, meaning as Megan very well explained it, that some of those lighter purple states may need policy solutions that may be very different from a California or a New York, for example. So what we're trying to do, today is actually the first day of having our government affairs SVP report to work. We just hired him, Ariel Gonzalez. He's going to be working closely with us, with you out there to figure this out, because what we understand that we can't have like a gunshot approach and expect things to fix. What we're trying to do is be very meticulous about what does a policy solution look like in a Louisiana or Mississippi, and what does it look like in New York and California, and then mobilize our resources, our volunteers in accordance to that. So including potentially having model legislation that we're going to look at developing. So having those, Hill Days or advocacy days at the state capitol, pushing for particular bills is not going away. In fact, I would say almost argue that it's going to get more intense. So we really depend on you and your efforts to be able to honing in and further focusing in what we need to get accomplished in a very much a laser-focused manner in the coming months.
And just to follow up to that, sort of beyond just the legislative element, is there also a plan to address sort of the administrative elements in the executive branch?
Yes, I think oftentimes we are, we're working with you, we're working with our volunteers, and when the staff is there with the staff to ensure that there are aspects of it, whether it's rulemaking or it's other parts that we're working on. Collective impact is an example. Collective impact isn't going to get done whether it's Houston, Dallas, or across states. Unless we also involve the executive side of state governments or local governments, along with other partners. So I think there's going to be pieces of this that is going to involve mobilization of partners, but also their non-traditional partners as well, in addition to the executive branch folks. So I do think that this is a critical piece, but we're also trying to figure out what. And sometimes the collective impact efforts in a limited amount of states or regions will give us that idea, and then others still we have to figure things out as to what are we mobilizing for. And I think there's some really good implicit bias being one, but there's some really good exciting things to think about in terms of what's happening with vaccinations across in the Northeast and other places. So there's other aspects of it I think that are very very sort of makes us excited about, including group prenatal care.
That's great. And Calvin added that reimbursement is a big part of it in rural areas, and regulatory is something else to consider. So thanks for those comments.
Megan, there was Sue Rose, thank you for sharing that feedback with us. Just to clarify, we mentioned local boards. What we mean when we say local is for the market. As many of you know, we no longer have state boards. We are now run by markets across the country. And so just to clarify, when we're talking about a local board, that would mean local to the market. So we refer to them as market boards, and we have quite a few across the country. And that's what we're basically saying, just to clarify. Sue, thank you again for bringing that up.
Yeah. And then Patricia, thanks, Steve. Patricia asked, why some states are amongst many others versus some states got sort of called out as sort of their individualized area. So, where some of the larger regions, like the West region, for example, it looks big. When you saw sort of the outlay of the country, it looks like a really big area to focus on. So I would just say, and curious, Dr. G, on your thoughts, that when looking at that, we're looking at sort of overall staff in those areas where there may be one market in an area like Tennessee, there may be multiple markets in a state like Texas, which has, 6 or 7 boards, or California or Florida that have, 9 markets, et cetera. So we did try to balance it out based on our staff footprint, based on the work, so that it doesn't mean that those states are getting any less resources. We're still getting individualized data. We're still having individualized state level advocacy plans in those areas. It's just a way for us to manage more effectively, I would say. Anything else to add on that, Dr. Gupta?
No, I think you covered it well. I mean, of course, there's a lot of financial aspects of this that went into figuring out, okay, a lot of the industry standards where they might be more giving, and in addition to then, as you mentioned previously, Megan, some areas are relatively resource poor, but they have the worst outcomes, so we want to be conscious about that too. So it was a complex sort of way to get to where we are, but we accounted for not just the ability to raise funds, but also the ability to have impact. Especially, it's very easy to sometimes get lost, those areas that are not able to raise funds. So we wanted to be intentional about that too, especially in some of the southern states who have not expanded Medicaid, who have actually have a larger proportion of the minority populations, and they have worse outcomes. So it's all these things that we're on some areas working on policy, but on other areas working on programmatic aspects, and then this is how it just turned out. But it was a multifactorial, as you mentioned, aspects of achieving there.
Yeah, and I think that's right, including, as Calvin points out, sort of the population, et cetera, sort of all of those things were taken into consideration there. That's right. So it looks like the questions have slowed a little bit. So I'm just going to call for more questions, and then I would love to know, and then we can let you guys go, if you have ideas for how to improve on this, or other ideas of what the mission committee could be doing locally, I would love if you could chat those in now. I'll also just chat my email address if you have questions or other follow-ups. I'd always love to hear from you, as I'm sure Steve and Dr. Gupta would as well. But if you, excuse me, I'm fighting a cold. But if you have other questions, please let me know. But if you have thoughts now, I'd love to see them in the chat. What else could we be doing? What else can we be doing to make sure that this transition is really effective as well?
And that's not just for this afternoon on the call. This is ongoing over the next few days, weeks, and months. One of the things you are going to see from us is we want to make sure that information and communication is always available. We never want anybody confused about their role or their responsibility. We want us to be organized together. I love the fact now that we basically are much more committed to leading with mission. It really will tie in all aspects of what we do as volunteers and volunteer leaders across the country. That being said, it hopefully is very obvious to everybody that this truly is a partnership. It is a staff and volunteer partnership in order to be successful, and we really need everyone to step up. I'll be very honest with you. One of the challenges we've had is we need to hold each other accountable. We must hold each other accountable because it's not about us, it's about our moms and babies. And so hopefully that message will be very clear to you moving forward. Calvin mentioned, boards. The bottom line is the board composition from the market board level is made up of whatever that market needs to be successful. In terms of number of people, diversity, backgrounds, it is the group of people that will, as Stacy puts it, moves the needle to help our moms and babies.
And we need to continue to diversify that to ensure, we're encompassing all of those folks. So thank you so much, Steve. Last question, and then we'll wrap up. Will the research efforts be expanded more of a clinic-based initiatives to encompass more public health, looking at social determinants, community-based participatory research?
Yeah, so this question is right on the money in the fact that, we want to make sure that whether it's our PRC research or it's social sciences research or others, including the group renal care, that we are including from a public health perspective those initiatives. So there is that. I mean, every day I'm talking about that, and we're discussing that actively. So this does not leave our mindset for a minute that what we do must be able to not only be scaled up, but be able to have an impact in terms of the goals that we talked about at the very beginning of the slide set. So it's not enough to have just clinical or research outcomes that are not being able to ultimately provide an impact to the population. So yes, one of the things you're going to hear about, for example, is this, we funded this research about the paid family leave, the long-term impact. Nobody has known what the long-term impact of paid family leaves are. This is the first research of its kind to show the enormous impact of having long-term impact of paid family leave to businesses. So it's these kind of things that we're helping fund. We would love to work with you to generate other ideas. There is a sort of think tank here with Kate Frobe at the Center for Social Science Research as well that we're looking at constantly, and a lot of work happening. So please, as Steve mentioned, one of the things to get excited about is all this work that is happening. So if you want to know about more or what's in the hopper, so to speak, how can you get involved? Please let us know. This is a really good time to get engaged and get involved in your community, as well as see what is nationally happening from a social science research standpoint.
Great. I said last question, but there's one more. So I think, and this is a good one, because I think, thank you, Russell, for raising a concern, because we want to hear concerns. If you have them, we want to hear them for sure. And it was just around how can we really maintain our presence at a state level in terms of advocacy? Can volunteers really do it alone? And so I would say, I am curious, Dr. Gupta, if you could talk a little bit about the policy staffing structure at a state level, because, we hear you and we think it is really important. And there are some different approaches we're taking to ensure that we can maintain that presence.
Yeah, no, you're exactly right, Russell. I mean, this is a really good point to make. We are cognizant of that. We're working very closely with Kelly Ernst, her team. As you know, there have been cuts over the years, so this is nothing new. We are trying to maintain what we have, how much of presence we have, knowing that we cannot be, from a policy standpoint, be in all 50 state legislatures at the same time, just don't have the bandwidth. So one of the things that, as I mentioned, Ariel Gonzalez has just gotten in, and we're actually going to be recruiting, for leaderships as well as folks to help us move this forward. But the idea here will be, how do we focus and how do we maintain presence, as you mentioned, effective presence in places that we want to have an impact. And it doesn't have to be a 20-year presence in one place. It has to be more like, okay, what do we want to get done in a particular state? Let's have some presence there, both in terms of employee potentially, or as a contract, in order to get some things done. Have the help of our volunteers to mobilize that particular issue. And then, it takes normally 3 to 5 years to make a change, to enact a bill in state houses. And then once that happens, let's move to the next one. So I think what we have not had is we've had some we've had some good approaches, but they have not been anchored in approach, let's get this thing done. It's more been, let's sign up on these bills and then follow through them. What we want to do is have a point of view for March of Dimes, involve you, and then start to move the needle in those areas. So that's where your input is really critical. But we're going to work with the bandwidth we have and hope that as we are able to generate the resources, we're able to then put them back into the communities and have a more robust presence in terms of policy moving forward.
And part of the benefit of this integrated staff approach is that we're recognizing the need to ensure that we have the appropriate MCH and policy staff in some states that maybe have gone without because we had such a focus on the fundraising staff. So we're able to kind of balance out the portfolios of staff in some of those states. So it may even mean an increased focus in some areas where we have had sort of lackluster support on the MCH side. So I think that you may even see some of that in the coming months as well.
Great. Well, Megan, thank you for all of your efforts and hard work. Dr. Gupta, as always, thank you for everything. And it's a pleasure to work with you and to watch all of the things that we're accomplishing. Folks, I especially wanted to say thank you to you all that have joined us this afternoon. There's no one more sensitive to being a volunteer than a fellow volunteer. And especially on the MCH side, you all have done so much for our organization. So I hope you'll accept my sincerest thank you for all you've done. And I hope you'll join us in making sure that we continue this fight for all of our moms and babies. Lots more to come. Please stay tuned. And we look forward to getting back with you soon with any updates. You all take care and have a great night.